Hello, my name is Melissa Louie. I am a geriatric social worker and founder of Senoir Habitat, a platform that helps seniors find the right home and community resources. With 148 preferences to choose from and the ability to book a tour at a senior facility anytime, we are the Match.com and open tables for senior facilities. To start, I'm going to share a story with you. Once there was a Chinese patient with dementia admitted to a Jewish nursing home that I worked at. Every day, she sat in the dining room but did not eat. Staff could not even encourage her to eat because she only spoke Chinese. Until one day, the problem was so severe that the medical team actually wanted to insert a feeding tube. I thought the solution was too invasive and believed she simply did not like the food. Because of that, I decided to speak up for her. When she got the food that she was accustomed to, not to my surprise, she started eating. If this resident's family was able to find a facility based on their preferences, in this case, language and diet, the insertion of a feeding tube would have never come up. I share this story not because it's unique, but because it is not. It is the story of many older adults admitted to a senior facility. Each year, millions of seniors are hospitalized and unable to return home. The transition to a senior facility is an overwhelming life choice for seniors and caregivers because they lack support and guidance. For example, hospital discharge planners still provide a list of senior facilities similar to this. Not helpful, especially since 1 in 3 nursing homes in the U.S. was cited for violations of federal standards. Senior Habitat was created to make senior facility selection and care transition easy. Unlike our competitors, we have the following features. Unbiased search results based on individual preferences and medical need. Community resources, online tour booking, unique assessment algorithm, screening tool, e-notify hospital tool, and a data analytic platform. Our target market is the 43.5 million informal caregivers in the U.S. Our distribution channel includes strategic partnerships with professionals and organizations serving the aging population. We have a subscription business model for senior facilities. Our next step, we have arranged with Universal American to pilot our platform for their Medicare patients needing post-acute care. The scale of the pilot will include 800 physicians serving over 23,000 Medicare patients. Care One, a senior care company with 52 communities, will also join our pilot. To improve care transition, we have a dedicated team with domain expertise, including myself, an entrepreneurial and an exit by Senior Bridge, the largest care management firm in the U.S. Thank you.
Great. Thanks, Melissa. So I'll start by asking you, now I'm glad you didn't say you were the Uber of healthcare, so that was helpful. There are a lot of companies that purport to do this.
Yes.
So how do you differentiate yourself?
Okay, first of all, so we actually help families find a facility based on their preferences. For example, if mom has a special diet, you can look for a facility based on diet. If mom is looking for a facility based on her medical need, ADL skills, you can look for a facility based on her skills. If mom actually have a pet and want to move into a community that welcomes dogs, she could move into a facility in our platform.
You could have that monitoring product for the dog walker too.
Yes.
Great. Others, questions?
Can you just elucidate the business model a little bit more? Who do you sell to? Mm-hmm. And then how do you get that information and how you disseminate it?
Okay.
And like what the economics are there?
Yeah, so we market to the families, caregivers, but also professionals in the community. But the subscription model is for the senior facilities. It's a monthly subscription plan.
Any other questions? Folks? Michael?
What other information are you capturing? Tell me if I pull up a search result on a particular institution, what am I getting?
Okay, so also it's the open tables for senior facilities. So similar to open tables, you could book a restaurant directly on the site. Here and everything, in real time, you could actually book a tour at a senior facility in real time. But also you can find community resources. So if you're looking for movers, geriatric care managers, if you're looking for elder care attorneys, so you can find that all on our website. So we believe that care transition is not just finding a home, but also support in the community for them to stay in the community so they don't get re-hospitalized. Because right now, hospitalizations for Medicare patients is 30 18% or anything of Medicare patients are readmitted to the hospital within 30 days, costing our government $17 billion every year.
So you said that the facilities pay to join, right?
Correct.
So how do you know they're good?
So first of all, and everything, unlike many of our competitors, we have an unbiased search results. So all facilities are listed on our platform. And so if facilities want to upgrade their version or anything, their platform, they pay to upgrade version.
And how do you qualify them in some way? Do you certify them? Are there rating reviews like an open
Yes,
table?
correct. So there's reviews, but also survey results from the country.
Oftentimes, what mom or dad wants is different from what the family wants.
Right.
It's different from what the hospital wants, et cetera. So who are you advocating for, and how do you manage that kind of process internally?
Okay, so we're advocating for seniors. Okay, so I was a former caregiver myself, and I actually moved in with my grandmother to provide care for her, and it was really, really challenging because we didn't feel comfortable placing her in a nursing home. And so we're advocating or anything to make sure that seniors are getting the right care, but also providing support for caregivers so they don't feel guilty placing their loved ones.
Okay. Other questions? We have a little bit of time, so we can take one audience question. Gentleman here? Yes.
Correct, yes. So the survey results for every facility is listed on our website.
Okay, great. Thank you so much.
Thank you.
Thank